Everybody, welcome. My name is Ruth Ochoa, and today we're going to go over a nice myofascial self-treatment technique that is great for hip pain, piriformis and gluteal pain, low back pain, mid-back and rib pain. So it really spans the whole body pretty much. It's kind of a nice technique to affect the entire body without having to spend way too much time trying to treat each area individually, because it's all connected. Let's get into it. So you're going to be laying either on the floor or your bed. If your bed is smaller than a queen, I would recommend laying on the floor, just so you have enough room to really spread out comfortably. If you are on a smaller bed or even a massage table, it's totally fine. It's just going to add a little bit different of an element because you're going to be hanging off of it, so it's going to intensify the stretch a little more. So try it on the floor, on the carpet. That's usually a nice, easy way to go. All right, so we're going to lay on our side. Go ahead and lay on your right side. If you can do this without a pillow under your head, that is better, but if you need one under your head, it's no big deal. So just decide what works best for you. And then we're going to take our left hip and bend that knee and bring the left hip forward so that it's touching the ground and it's not resting on top of the right leg. From here, we're going to outstretch both of our arms. And this is where the floor comes in handy. So if you don't have the floor supporting you, this might already feel like a pretty big stretch. So just decide what works best for you. And we're just gonna, so both arms are outstretched, left and right arms are outstretched, palms are open. And then from here, go ahead and extend, straighten out both of your legs gently. Good. Just notice what you're feeling just in this position. Take some breaths, go ahead and close your eyes. And just start slowing your breathing down. So at this point, you might already be feeling a good amount of stretch somewhere around your left hip. You might be feeling it in your rib cage or even up by the front of your shoulder. Just kind of depends what you got going on. And so as you settle into the stretch and you feel like you want to engage a little bit more, we're going to go into telescoping. So with telescoping and with all myofascial stretching, we don't want to push past what we call the barrier. So what that means is if we're in a position and we're feeling some nice sensation and engagement in our body, but we think, oh, I could go a little bit further, we really don't want to push that far. If you're starting to feel any pain while you're doing any myofascial self-treatment, that's too much, and you want to ease your pressure or ease your position a little bit. The body's not going to release if you're forcing. So we're trying to work with our bodies. Anyways, we're going to start telescoping. So go ahead and start just extending both of the arms and fingertips as if you're gently reaching off into the distance, just trying to reach something just a little beyond your reach. So we're not reaching as hard as we can, like we're trying to rip ourselves in half. Just a gentle little reach with both hands, and you can feel how that starts to engage your tissue a little bit more. And then go ahead and activate telescoping those feet as well. So that'll probably feel like pointing the toes gently, and with each breath, just picturing the legs getting longer and longer. So my left leg is pretty straight now, but it's at a diagonal and is rolled in front of my right leg. My right leg is straight, both toes are pointed, and I'm breathing. So as we're telescoping, you might notice that it sounds like it would feel good to move. So go ahead and let your body move. Find where it wants to be. So I'm feeling like my left arm, as I'm reaching, that it would feel good to just kind of lift it up a little bit more too. So I'm just going to follow that. So experiment a little bit. Just be curious. See what happens. Be gentle but curious. And keep breathing. Are you noticing some tension somewhere in your body? Maybe some pull around that hip. Send your breath to that area. And as you're breathing into that area, just visualize melting, softening, and lengthening happening all throughout your body. Keep that telescope going. It should feel good. It shouldn't feel like hard work. If it's feeling like hard work, you're doing too much. And keep breathing. Good. And don't be afraid to experiment with the movement. We don't want to be locked in these positions. We want to have softness and flexibility as we're stretching. Keep breathing. You're doing awesome. And so from time to time when you're holding these stretches, because we really are trying to hold for about 5 minutes whenever possible, you'll notice that there'll be moments when you're stretching where you'll feel a good amount of pull or a good amount of sensation of some type in your body. And so again, we don't want to push past that. When you feel that, just kind of soften, breathe. Don't force, and wait. See if you need to allow your body to move a little bit more. See what feels good for you. Now, if the left arm's kind of getting tired of being where it is, experiment with where else it might like to be. So maybe it wants to come up a little bit. Keep that telescoping going just to see what that feels like. Eyes should be closed. You're focusing on what you're feeling. Slow, deep breaths and softening. Good. So just keep breathing. Remember, you are more than welcome to hold this for more than 5 minutes if that feels right for you. But our goal is to feel comfortable, feel our body releasing, feel some change happening. So keep breathing. Remember, when the fascia releases, it may feel like butter melting. It might feel like a taffy stretching, like a big deep stretch. Or you might just notice your whole system just feels longer and softer. That's all very good. Good. So the telescoping is pretty important for this stretch, especially if you're on the ground. Be mindful of what your shoulders are feeling. So if it's feeling like a little too much for the arm that's on top, just bring it a little closer back to midline and find a new position for it. But keep the whole body involved in the stretch and the movement. Good. Notice what is going on in your right hip. Maybe you are tensing that butt cheek a little bit. Let it relax. See what happens. Good. I always recommend when you're doing your self-treatment to close the door of the room you're in, turn on some nice soft music that you find really relaxing. Tell your family you need a little time and just focus on what you're feeling. Good. So from there, you can stay there for as long as you like, or if you feel like you're about done on that side, just go ahead and slowly pull yourself back together. Take your time. Do a little self-rebounding if you want to, rocking back and forth. And then we'll push up from here. Let all the blood flow where it needs to flow. And then we'll turn onto our left side. So same idea. Allow that right leg to come forward. Extend both legs. Extend both arms. Breathe and soften. And telescope. So for a lot of us, it's going to be a challenge to really have the top arm, in this case the right arm, reaching back for that long, and that's really not the goal. The goal is not to stay static in these stretches. The goal is to find the freedom and the movement of your body. We get into patterns of movement, and we tend to just kind of repeat those patterns. And over time, that can really cause more pressure on the structures in the body. It can create more pain. So when you're doing your self-treatment, it's an opportunity to explore the movements your body's wanting to do, but we just don't find ourselves in these positions very much. So just keep breathing, keep those fingers and toes telescoping, and allow movement to happen when it needs to happen, allow noise to happen. So sometimes when you're stretching, you might notice you start sighing a lot, or breathing kind of heavy, or moaning and groaning. That's all good. It's okay to make some noise sometimes too. So both toes should still be pointed. If you are on the ground, you might be experimenting with bringing the right leg up a little more. You can see what it feels like to have it bent versus straight. Find what feels good for your body. There's no one size fits all. So you're going to have to be in charge of finding what feels right for you. The good thing about that is your body is giving you tons of feedback and information in the form of sensations, one of them being pain. So use that information. Use what you're feeling to help you find the positions your body wants to be in. If you have no idea what I'm talking about, don't worry about it. Just do the stretch. And as you do it more often, you'll start to connect with those sensations in your body. They can be subtle, but powerful. Good. So my right arm is ending up kind of resting on top of my head right now. That feels good for me, so that's what I'm doing. Still telescoping through both toes, reaching just a little. Not a big hard reach like we're gonna rip ourselves in half. Just enough like we're just elongating. Just like we're a cat, just stretching out, getting a little longer. Good. Keep your breathing nice and slow. Keep your mind focused here and now. You can worry about later. Remember, our goal is to hold these positions for about 5 minutes, as long as there's no pain. There should never be pain when you're treating your fascia. If you're feeling pain or discomfort, you're pushing a little too far. Your body won't be able to relax. Good, keep breathing. Good. Keep elongating. Notice what's going on with your left hip. Great job. So always come out of these positions nice and slow. Take your time coming back to upright. There's no rush. Ooh, feels good, right? So it's always fun to do a body scan before and after we do any kind of self-treatment. It's really actually pretty important to start your self-treatment sessions that way. And all that involves is a quick assessment of just taking note of what we're feeling in our body, where we're noticing tension, and just kind of checking in with ourselves, because we don't do that enough. So I encourage you to check in, do your body scan before you do your self-treatment, and then do it again afterwards. It takes seconds. It's really, a quick, easy thing to do. But that'll help you reinforce that, hey, I am doing a good thing for myself. I'm creating change, and that's my goal. So great job today. Give it a try, see what you think. Be consistent, and have a wonderful rest of your day. Thank you.